Recently, I had sudden, severe stomach pain and rushed to the hospital. There, doctors gave me a frightening diagnosis: celiac artery aneurysms, a very rare and dangerous condition, with only about 180 cases recorded worldwide. Everyone was shocked when the doctors said they could only offer palliative care and no real treatment. They were hopeless about my case and said they had nothing to do, as I had lost 90% of my kidney and liver function. They said very frankly that I may die any minute. I was unable to walk or move for a few days. Honestly, just that diagnosis alone could have killed me due to the shock it delivered to my nervous system. They immediately started me on a very high dose of cortisone, 1,000 milligrams. Despite the doctor's gloomy outlook, I chose to stay in the hospital and remain hopeful. I then spoke with Hakim Shabaz, who advised me to stay in the hospital to monitor my health status but follow a strict diet and use some alternative treatments so my body could focus on healing. Following Hakim's advice, I began to slowly reduce my cortisone dose. A few days later, the doctors changed their diagnosis to polyarteritis nodosa, a disease where blood vessels become inflamed and can damage organs. Soon after that, they told me I had 24 hours to decide whether to start chemotherapy, claiming it was necessary for my survival. This terrified my loved ones, but I stayed calm and believed in my body's ability to recover. I declined to take their treatment and continued to stay in the hospital just to keep monitoring my health while taking alternative treatments prescribed by the Hakim. Over time, it became clear that the high-dose cortisone actually weakens the tissues and vasculature, exactly what you don't want with an aneurysm. Chemotherapy, because it's so toxic, would likely have caused my fragile arteries to rupture. In truth, my real issue was having too much cortisol in my system for too long, caused by stress, working too hard, drinking a lot of coffee, and not sleeping enough. That led to inflammation and infections. Even though everything in modern medicine seemed hopeless, I began to recover quickly. The hospital staff was amazed by my rapid improvement. When I felt strong enough, I left the hospital to continue healing at home, using alternative remedies and a strict diet. Leaving the hospital came with another huge stressor. I was handed down a hefty medical bill of thousands of dollars, while the only treatment they could offer me was immunosuppressants like hydrocortisone and aspirin. Now comes another shock. My insurance company abandoned me when I most needed them. They refused to pay my bills. Another shock. This could have killed me also. Anyway, within about a month, I felt much better. My blood test results were nearly normal, and I could walk and talk like before. Originally, the doctors wanted me to stay on cortisone and chemotherapy forever, but my body healed in a more natural way than they expected. My latest blood tests show major improvements, and my inflammation levels are now normal. I no longer take any medications. In less than 2 months, I returned to my normal life, including going back to work, even though I didn't tell anyone first. I just couldn't stand being idle any longer. Looking back, I'm grateful I trusted my body's ability to heal and chose a path that, against all odds, led me to health and stability once again. 1. Balance hard work with proper rest. It's good to work hard and chase your goals, but your body also needs enough rest every night. Sleep isn't just downtime. It's when your body repairs itself, stores memories, and recharges your energy. If you regularly skip sleep or don't get enough of it, your immune system can get weaker, and over time, this may lead to serious health problems. 2. Think twice about drinking coffee. Coffee may give you a burst of energy, but it can also upset the natural balance in your body, trigger stress reactions, and disturb your deep sleep. This deep sleep, called delta sleep, is very important for full recovery and healing. If you drink too much coffee, it might leave you feeling more tired in the long run, increase anxiety, and throw your hormones off balance. Cutting down or quitting coffee can help you sleep better and feel healthier overall. 3. Be careful with modern medical systems. Hospitals and doctors are very helpful in emergencies, but depending only on modern medicine may not always be the best idea. Sometimes the diagnosis may be wrong, or treatments might be too harsh. These treatments often ignore natural ways that the body can heal itself. If you're facing a health issue, it's wise to also consider gentle, holistic methods before standard care, if it's not an emergency. Getting advice from both sides can help you make better decisions. 4. Don't be afraid to get a second opinion if something about your diagnosis or treatment plan doesn't feel right. it's okay to ask someone else. Experts outside of regular hospitals may offer new ideas and solutions, often using natural treatments like herbs, diet, and lifestyle changes. These approaches may work alongside or sometimes instead of conventional medicine, especially if you're worried about side effects or getting the wrong diagnosis. 5. Watch out for the limits of health insurance. Health insurance can be helpful in some cases, but sometimes it lets people down when they need it the most. Policies often have small print, and they might not cover the full cost of long-term treatments, necessary procedures, or may not cover anything at all.